Instead of piling pressure on governments to address their healthcare needs, which might never come, residents of Kubori in the Northeast region took a bold decision to construct a health center for themselves. The community's dream of making quality healthcare easily accessible for them might, however, not be realized soon. The residents have run out of money to complete the critical project. They are appealing to development partners and charity organizations to come to their aid. There's more in this report by correspondent Ilyasu Tanko.
The Kubori community in the Mampurgu Muaduri district of the Northeast region is located more than 200 kilometers from Tamale. It has a functioning health center operating in a building that was donated 30 years ago. But over time, the facility, which also received cases from communities in the North Gonja district, has become dilapidated. It has no beds and emergency supplies, and patients are treated on wooden benches and rubber mats. Emmanuel Wuni manages the facility.
Due to the lack of infrastructure, the structure is not having all the necessary areas where we are supposed to render services. Those that you are seeing there, they should have been found in a place what we call injection room or cannulation room. But because there's no adequate structure for us, we are improvising the space outside there to render some of these services, which at times is not the best. Because some of the procedures are such a way that you have to provide privacy to the client. But due to the lack of space, we don't have any tenant plan to improvise those areas as places where we pass our cannulas or our lines and even administer certain kind of medications out there.
With the population increasing, doctors were unable to treat patients with complicated conditions. As a result, the over 15,000 people, including pregnant women and babies, depending on this facility for their healthcare needs, have been forced to resort to witch doctors to attend to their health problems. After several unsuccessful calls on government to intervene in their situation, the residents decided to take matters into their hands to build a new facility. The initiative was conceived by a group of young graduates, the Kubori Youth for Development, who are driving change and championing development in the community. The residents raised over 200,000 Ghana cedis and built a new facility with an intensive care unit, operation theater, and extensive diagnostic facilities. But soon, contributions towards the project dwindled as they ran out of cash, and now these uncompleted facilities remain unutilized and unequipped. A member of the Kubori Youth for Development, Seidu Mubarak, speaking to Joy News, appealed for help.
It was built by government. That was 1990s. So all the time, because of so many people, the hospital normally become congested. So the community decided to put it upon themselves to come out with an idea that we should try and get a project and add to it so that it will make things easier for the hospital. So we decided to come out and build this thing. It was started by communal labor, contributing on one city by the community people. So we decided to come out with this particular thing. So we are now appealing to government, because as at now we are tired. We don't know how we'll be able to complete this thing. So we are just appealing to government, opinion leaders, NGOs to come out to our aid and help us so that we'll be able to complete this project.
The Kubori Health Center serves over 10,000 people in the vicinity and serves as the major referral point of primary health care for these farming communities. Residents, as well as healthcare providers here, want government to intervene to complete the project and put it to use.
The idea of turning away patients because of the terrain in which we find ourselves, humanly, is not possible. The best that we could always do is to probably turn benches to beds to admit people in the yard. At times, we have to look for masks when it becomes critical to put certain clients on a mission to be able to administer treatment. We appeal to well-meaning Ghanaians, benevolent organizations, well-wishers to come to the aid of the good people of Kubori to help them complete this structure, to help render quality health services to the people of Mampuru Madu and those surrounding communities around.
Ilyasu Tanko for Joy News.